The Wall Street Journal reports Pfizer may not receive authorization for its COVID vaccine for children aged 5 through 11 until November. The news comes after the company submitted data seeking approval for that young age group yesterday. Let's turn to emergency medicine doctor Toni Gross. She is the chief of the emergency department at Children's Hospital in New Orleans. Dr. Gross, thank you so much for being with us. So walk us through, first of all, what's going on in your hospital. What are you seeing in terms of pediatric COVID infections?
Yeah, thanks for having me this morning. We are still seeing cases of COVID-19 in all age groups. Our hospital treats up to age 21. Currently, we have 6 patients hospitalized that are positive for COVID-19, which is a decrease than what we saw at our peak when we peaked out at upper teens up to 20 max during this Delta surge. So we are seeing some resurgence, which is good news for us.
So listen, there's a possibility that a vaccine will be made available for kids age 5 and up, at least in the next few months. So what factors should parents consider before vaccinating their children?
So I think that parents should consider factors similar to when all vaccines are considered, and that is the safety of your own child as well as the safety of the community around you. And that's what vaccines are great for. The data that Pfizer has submitted so far is about 2,000, a little over 2,000 patients. It's been shown to be safe as well as effective in generating antibodies towards the COVID-19 virus. And I think that it's really important that parents do follow this the same way we followed the initial vaccine data when there was, X number of patients included. But as more and more people received the vaccine, it became known that it was safer than even what could have been initially predicted.
So let's talk about this. Multiple states are requiring healthcare workers to be vaccinated, and some workers are pushing back. In Louisiana, we know several hospital staffers are suing in an attempt to avoid mandatory vaccination. What are the conversations like at your hospital?
So the conversations at our hospital have taken place over the past couple of weeks. And so far, I think that our vaccine rates among healthcare workers in the hospital, the physicians were over 90% vaccinated. We had more than 50% vaccination rate, and that there was response to the mandate that more healthcare workers are making the appointment to get that vaccine. And there will be people who have medical or religious reasons not to receive the vaccine, and the hospital system has made plans for those individuals. And so I think that we will see that the vast majority of our healthcare workers are going to be vaccinated. I think that as a community and healthcare leaders, we have to set that example for the community that we want to protect our patients as well as ourselves by getting vaccinated.
I want to ask you about something else specific to where you work. It's been about a month now since Hurricane Ida slammed into the Gulf Coast. Curious about how, your hospital fared. Was there any significant damage? How are you doing now?
Yeah, thanks for asking. It has been 1 month to the day today since Hurricane Ida made landfall. And the hospital fared really well. Our generators kept up. We did not have to delay any of our normal operations for the hospitalized patients that we had. Our outlying clinics, our ambulatory division has done an excellent job in getting things back up. And, that's one of the challenges after major storms like that is business continuity for our pediatrics practices. And some of the parishes outlying to us, not necessarily Orleans Parish, are still waiting to get internet back. And they did have more significant damage, but we have been able to mobilize those operations to other locations so that we can continue serving the kids of Southeast Louisiana.
Well, I'm happy to hear that, and I'm happy to hear that you're able to sort of help others out. It's shocking, though, that they're still waiting for internet access in some locations. It just gives you a sense of just the sort of damage that Mother Nature can do. No matter how technologically advanced we are, sometimes we just cannot, protect ourselves against the wrath of Mother Nature. Dr. Toni Gross, thank you so much.
Thanks for having me.